So as we said, the idea of today is we get to hear more of views of what the people that are dealing with the patients actually feel is necessary and needed and what will make this work. You know, I think people want to hear from the people on the ground what can make a big difference. And the second half is going to be very much asking you guys to put your heads together and work that out so we can say these are the priorities we feel. We thought it would be good to get a little bit of background information from a second perspective about what is actually going on in Barnet. Penny Wiseman, who, I have to say, I was her SHO many a year again. Everything I know about geriatrics is down to Penny.
Oh dear.
So just really giving you a little bit about the Barnet story and what it was like presently to die in Barnet from the secondary care perspective.
Oh, sorry, yep. I'll come over here.
Just this one.
Sure. Good afternoon, everyone. Can you all hear me? Excellent. Right, so I'm going to talk about dying in Barnet Hospital, and I'm going to concentrate the next 10 minutes on patients over the age of 75. And I think we've learnt quite a lot from analysing the data of patients dying in Barnet about what we can do to improve end-of-life care. So, of course, Barnet Hospital is really quite at the north of the borough. So I know a lot of you are from Barnet CCG, but actually 40% of our patients come from Barnet, but 40% come from South West Herts. And we have significant numbers from Enfield and Brent and Harrow. And of course, I think you're... Hello? Not all... Can you hear me if I talk like this, without this? Hello, hello.
So just say as long as the red light's on, it's working. Yeah.
Hello, Grace. And of course, a lot of Barnet residents go to Royal Free Hampstead. We have 900 patients over the age of 75 dying in Barnet Hospital every year. And if we look at the equivalent statistics for what's happening in these boroughs, we know that another 480 patients over the age of 75 are dying in care homes, and only 320 are dying in their own homes. So if you're over the age of 85, only 1 in 6 of you are going to die in your own home. But of course, we're not saying that dying in hospital is inappropriate. Hospital is actually very, very appropriate for a lot of elderly patients, particularly where there's a chance that medical intervention might help, that medical intervention may prolong life, that medical intervention may relieve symptoms and can only be provided in a hospital. And for those patients, yes, even though we end up failing, we still want to give them the benefit of the doubt. But there are a significant number who are actually probably worse off by dying in hospital. And our nursing colleagues are quite often look oddly at us and are clearly giving us the feeling that as consultants and as doctors we've probably gone a bit too far, and that actually for some patients dying would be thought it was... Sorry. That's all right. That there are better options than dying in hospital. And hospital is certainly not the peaceful, stress-free place. The chances are that if you've died in hospital, that you've had drips, you've had many, many interventions, you've almost certainly had a CT scan of head, chest, abdomen, you've had intravenous antibiotics, you may well have had a catheter, and you may well have had a fall and developed a whole lot of other complications of being in hospital. 1 in 4 of our patients, elderly patients, certainly if you've got dementia, develops delirium, which is a very, very stressful thing to go through. So the worrying thing is that 150 patients over the age of 75 actually die in A&E or die within 24 hours of being admission. And A&E, to die in A&E is a pretty terrible thing to happen to you. I've been looking after patients where we've had grandchildren in the resuscitation area, sitting with an elderly grandparent who's dying, with other things going on, patients next door being resuscitated, intubated, and it's not a good place, and certainly with no dignity at all to die in A&E. And the 150 patients, we do wonder what are the reasons for them coming in and dying within 24 hours. And obviously one of the issues is the difficulty of diagnosing death. And we understand this. It's sometimes difficult for us, but obviously sometimes there's difficulty in the community coping with dying. But sometimes relatives come in with the dying patient and say things to me like, I told them not to call an ambulance, I pleaded with them not to bring the patient to hospital. So I think what I'm saying is that a discussion with the patient or with the relatives, or having an idea about what the patient would have wanted in these situations beforehand, would have made all the difference. And that also obviously applies to the patients who've been in over 3 weeks in hospital. Knowing when to stop can be very difficult. As doctors, we go into cure mode, and we almost feel we need permission from relatives and patients to stop. When medical intervention is doing really no good at all, it is very difficult to stop. And if we had some idea about what the patient would have wanted in these situations, it would be very helpful. So there were quite a lot of people living in our catchment area over the age of 75. There are thousands and thousands. So who do we choose to start some planning with? Well, the first thing is that if you're over the age of 85 and you've been in hospital this year, the chances are 45% of those are going to be dead within the next year. If you're over the age of 75, and if you do die in hospital, a third of those patients have been in hospital or been in the emergency department the month before. So this clearly is an opportunity for us in secondary care to give those of you in primary care some information about what are the limitations, what are the potential for treatment, and what are the limitations for treatment. And I think finally, care homes. About a quarter of the people who die in Barnet Hospital are from care homes. And as you can see on the slide, even a quarter of them were in hospital the month before. And if we do the calculations that 480 patients are dying in care homes, and we've got 210 per year, that's 1 in 3 patients in a care home are actually dying in hospital. And I think we could do some work around there. And then finally, it's down to all of us. We can't cope with this. I think we have 8 consultant geriatricians, and there we've got 60 care homes who've admitted patients who've died in the last year. And that would probably take a full-time consultant, probably 3 to 5 years, to do advanced care planning in just those 60 care homes. In fact, we've got about 110 care homes. So it can't just be us. We need to work together. And I think every opportunity that any of us have to talk to the patient and to start the process, and then the others build on that, would be enormously helpful.
So thank you very much, Jenny.